Uma.
Okay, good afternoon, everyone. I'm Lalita Armugam, your host for this enlightening and engaging English webinar for the month of September. It is my pleasure to guide you through this virtual gathering who are passionate about overcoming and preventing drug addictions through the power of NLP, NeuroLinguistic Programming. Today, we have our esteemed speaker who is expert in his field, will generously share his knowledge and practical experience with us. I'm so happy to have this chance to introduce to you our speaker for today, Dr. Edward Chan, who owns PhD in Psychology, Master of Science in Learning, Master in Nutritional Medicine, and Bachelor of Science of Honor in Psychology. Dr. Edward is also a board-certified sex and couple therapist, fellow of the Malaysian Association for Psychotherapy, board member of the International Society of Psychotherapy, Counseling and Psychiatry, and fellow of the World Council for Psychotherapy. Not only that, Dr. Edward is also an invited speaker by LPPKN, Ministry of Women and Social Unity, Family Health Forum, and invited speaker for the 9th World Congress for Psychotherapy, a keynote speaker for the International Psychotherapy, Counseling and Psychiatry Conference, and invited speaker for the 37th European Psychiatry Conference on Couple Schema Chemistry. In addition, Dr. Edward is also an author of Love May Not Be Enough and co-author of Handbook of the Current Research and Practices on Cognitive Behavior Therapy, CBT in Asia. Many of his research has been published in various publications, such as in the Journal of Reattached Therapy and Developmental Diversity, Journal of Cognitive Therapy Theory and Research, and in the International Journal of Psychiatry. Not forgotten, he is also accredited as reattached therapist and credited as Aman Clinic Therapist. As per stated earlier, Dr. Edward expertise and experience in the field of psychology are truly outstanding. In his competency, training, and exposure to the field are rich sources of knowledge and inspiration. So, Doctor, can we start our webinar for today, Doctor?
Sure. Thank you for that, Lalita, who is one of IPC International Psychologies Center student.
Thank you.
You are doing a number of psychotherapy courses, right?
Thank you.
Fantastic.
Okay, Doctor.
Thank you for that kind introduction. And I may add, I mean the introduction was long enough, but what is of particular relevance today is I'm also a certified substance abuse counselor, which is not many in the country on that.
Okay, great, Doctor. So, Doctor, for the first question, can I?
Yes, go ahead, please.
Doctor, can you explain to us by understanding what is neuro-linguistic programming?
Right. Of course, NeuroLLinguistic Programming, also known as NLP, was very much popularized by the Anthony Robbins. Some of you might have heard of him. He was a coach for President Clinton. Very famous trainer with no qualification in psychology. But still, he managed to use NLP to help a lot of people and be a very influential trainer, like coach. So that's NLP. Partly thanks to him, it has become very popular to be used as part of psychotherapy or the life coaching, mental wellness coaching. Right, but NLP itself was founded by a couple of psychologists, Richard Bandler and who's the other guy? Okay, forgot that. Anyway, couple of psychologists in the 80s, and it's basically an approach to help people to change their mindset you using the language, right? Because there is the idea that language influence the way that we think, right? Which is probably why the children can also have depression because they can think and have language, you know, as young as 2 years old, but younger than that, you know, pre-language, maybe they might not be capable of having depression. We don't know. Right?
Okay, doctor.
Mm.
So, doctor, drug addiction is a disease that affects a person's brain and behavior and leads to an inability to control the use of a legal or illegal drug or medicine. So, how NLP is related with addiction, and what are the specific techniques of NLP that can be used to help people to overcome drug addiction?
Yes. Yes, drug addiction has been classified as a psychological disease, right? But we need to also understand it psychologically, and psychologically, if you remember from last month's webinar, we were talking about different parts: internal family system, IFS, and voice dialogue. So in drug addiction is also related to that somewhat, because there are multiple parts. So these parts can be concurrent or sequential. All right. What do we mean by concurrent? It means like, do I have a drink now, or you know, or maybe I'll have a healthy meal instead. Right? I'll have an alcohol or healthy meal instead. So you have two parts going on at the same time, right? And in sequential, it would be like, you know, I'm pretty good, healthy, and then like later, you know, get into drug abuse or something, right? So that will be sequential. So there are two parts of me at least, right? So we need to understand that in itself, and NLP then can be utilized to treat these addicted parts, if you like. All right, and we can talk a little bit about how we can do that using NLP, if you like.
What will be the best technique for NLP, doctor?
Right. So there's a technique called the Swiss technique, or the squash technique. So what it is you know, maybe we can have someone doing a role play to demonstrate it. Anyone has any addiction? Any of you? No? Not even food addiction is very common, you know. Ice cream addiction, yeah. Cake addiction. So who like to do a role play to demonstrate this NLP technique?
Okay.
Yes, we need one of you to role play to demonstrate it. So who has any addiction? Sugar addiction, shopping addiction, whatever addiction. Yes, Dr. Natalie, any addiction? No addiction. You're all very healthy.
Screen addiction.
So then role play, pretend to be one of your patients. All right. So who want to do that? You take up a role as one of your patients. Opportunity for learning. Dr. Natalie, you want to do that?
Yeah, can try, but don't know how.
No, try. Okay. So what sort of addiction you have? So you are the patient. All right.
If I patient be drug, because patient want comfort, so more on drug.
Drug. So what? Heroin, LSD, magic mushroom. What sort of drug? Ice.
What drug? Panadol? Normally Panadol.
Okay. All right. Yeah. So this is also can be abused, right? Medicine abuse and addiction. All right. So what I need you to do then, Dr. Natalie, as this patient, is to you can close your eyes, all right, and I want you to imagine, right, a very big giant television screen, all right, and in this screen you can see yourself being very healthy, right? Free from addiction. This is part of you. But then on the top right side of the screen is a little picture, right? Of you abusing Panadol. All right. Maybe you have a slight headache and then you take more and more. That sort of situation. And this little screen become bigger and bigger until it becomes the whole big television screen of you abusing Panadol. You are seeing that, Dr. Natalie? All right. So okay. So you can continue to close the eyes. Right. So what we are doing is we're putting the patient in the situation of their addiction, right? To surface the addicted part of the patient. All right. So then so with that we then want to again squash that, right? So then again on the top right side of this television screen, but Natalie, you can again see yourself as the healthy part, right? Exercising, eating nicely, all right? And then it becomes larger and larger until wipe out the addicted part. All right, so the whole screen now is you being very healthy, looking nice, exercising, having good relationship, right? And now, Dr. Natalie, I want you to climb inside into this television screen, all right? And be this healthy part. Let us know when you've done that. Raise your little finger on the screen so we can see it. All right, you're there. You can close your eyes. Let us know. All right, so you're there. Yeah, with this person, healthy part. So how do you feel at this healthy person.
Want me to share out how do I feel?
Yes, yes.
Um,
Yeah, okay. Continue closing your eyes and share with us, right?
Need to share out?
Yes, please share out.
Okay. I feel I'm good because I'm healthy. So I wouldn't need any more for the Panadol to overcome my headache.
Very good. Very good. Okay. So yeah, you can come back and be with us. So this is the technique, and we will do it several times, of course, right? We repeat it several times until it is really uh ingrained in the patient's mind, right? And so what we are hearing is not only the feeling, but also the thinking, the language, right? Because the patient is telling us she doesn't need any more Panadol, all right, to overcome her headache, right? So you can use it for any type of addiction, right? Alcohol, the shopping, cake, type of addiction, which is saying, right, that they have two parts, either concurrent or sequential, right? Either way, it can be done to have the healthy parts overcoming the addicted part, right? So in that will be one of the best NLP techniques to use for addiction, right? Another one would be the whereby you okay. So there's another technique which is related to the NLP called timeline therapy. Not sure whether you heard of it. You heard of that? Timeline therapy?
Timeline therapy.
Yes. No?
No idea.
Okay. So you guys know about schema therapy, right? And restricting schema. So timeline therapy is a little bit like that. It is getting the patient to trace back in time, the source of the addiction, right? So you trace back in time, and then you then do some reprogramming there, right? Because the assumption is that beginning time that started the addiction. If we do some reprogramming, then it will change the current situation, right? So that is a technique that is related to NLP that are often used together with NLP, timeline therapy. And yeah, another one would be anchoring.
Come again, doctor.
Anchoring.
Anchoring.
You know what is an anchor?
Yes.
Right. So what is an anchor?
Like host.
A what? What do you say, Lalita?
Anchoring.
Anchor, yeah. What?
Any program? Do you mean that? No.
Well, anchor is actually the thing you put under the boat.
Under the boat. Okay.
That's an anchor, right?
Okay.
It's a very heavy macro thing that will help the boat to, or even a ship to be stable, right? Not the drift apart. So this is a metaphor that the NLP use for therapy. All right. So how it works is we first of all, right, help the addicted patient to access, in this case we will say her, right, resources, right? So if we continue the role play, Dr. Natalie, you as a patient, I want you to like think back, of the time, in the past, maybe when you were, really happy, really healthy and energetic. Close your eyes. Can you think of that and describe to us what how that was like? Where you are free from addiction. You found a picture of that, Dr. Natalie?
Yes.
All right. Okay, describe to us what this picture look like.
On that time, because still young, then I can do a lot of things. Then I can reutilize my time and I can value my life lah on that time.
Fantastic. Fantastic.
Even I know that my sleep quality on that time is very less, very poor, but I feel that I'm satisfied for what I have lah on that time. I feel happy.
Great. So I want you now to pull your right ear a little bit. Yes. And when you do that, you are in that time. All right? Yeah, you can let go of your ear now. All right. So this is, yeah, you can let go of your ear now. Yeah, it's okay. All right. So this is your anchor. Right? So whenever you want to go back to that time, you just pull your right ear and you're back to that time with all the resources, the feeling of that time. All right. So when you are in your addicted self, right, you feel like having a Panadol, then all you need to do is just to pull your ear. Go back and go back your resourceful self to overcome the addicted self, right? So these are very powerful NLP techniques as well, right? So to help the patient access their resources. So everyone have resources, right? Like for the time when they're happy, they're in good health, right? Free from addiction or whatever. So we just need to create an anchor, like hypnosis, right? So that and all hypnosis is self-hypnosis. So NLP and hypnotherapy are very much related. Okay, so then you tap into that and you hypnotize yourself back into your healthy path, right? So this is another very powerful NLP technique that can be utilized very fast, very quickly by anyone, right? That has this multiple and sequential parts.
So Dr. Edward, Sorry,
Yes.
can I ask the questions?
Yes, please do.
Okay, Dr. Edward, you means timeline therapy using together with the NLP to divert the patient's focusing, you mean?
Well, timeline therapy is about changing the original causes in time of the addiction or any other problem, right? So we go back in time, right? And say for example, if I ask you as this patient with a Panadol addiction, when was the first time you were using Panadol?
Yeah.
So you then you would tell me, all right, or maybe you want to close your eyes and imagine back when was the first time you did that, right? Can you see to yourself, right? How old were you when you did that?
It's on 26. When the time I have the first time of the dengue, because of fever, then admitted in the hospital, the doctor gave me all the Panadol a lot. Hold on my hand, asked me to eat. Oh, I
Okay,
feel like fever on the time.
so close your eyes, all right? Close your eyes if you were there in the hospital around 26 with this bunch of Panadol in your hand, all right? And I want you to tell yourself, right, that you can manage your headache without. All right, I can manage my headache without this Panadol. All right, and see yourself managing with this headache that you do need to take the Panadol, right? And it is very manageable. Yeah. So take a deep breath and come back to it. So that is changing the timeline, right? That is the original cause of the Panadol addiction. We change that, then we change the current timeline also.
But Dr. Edward, how to say, whatever you say, there is a real things happening to me. On that time, I hold the Panadol, I just put aside on the bed, on the below. I didn't take it.
Fantastic. So you don't need NLP. You don't need online therapy. You already don't. Yeah. So precisely that. But say some we have patients, they took a lot of Panadol, then they become addicted. So that was the cause of it. But still, we can go back in time to change it for them because the mind is very powerful, right? So when they change that memory, then they will change their addiction as well, right? So we need to. So that's timeline therapy, which is very much related to NLP, changing the programming of their mind, right?
It means
Yeah.
timeline therapy is to change the mindset, the feeling on that time.
Well, the original source of the disease of the mindset, right? So the mindset is I need Panadol. So in order to change that, we need to go back to the original source of that mindset, right?
So that means we no need to tell or educate the the right thinking of the using or the right way to utilize the Panadol, the benefit of the Panadol, or even though the side effect of the Panadol?
Well, you can add that bit. I mean, it depends on what the addiction is, right? I mean, Panadol might have its you say to right, but if but it's not going to be dangerous. If you don't use Panadol, the patient is not going to die, right? So in this sense, then the message can be given to the patient that yes, she can manage the headache without, right? But it depends on what is the medicine, what is the source of addiction, right? But most sorts of addiction, the patient can manage without, because addiction is actually a sort of dependency, a physical and even a psychological dependency to to help with certain type of pain, either physical pain or emotional pain, right? So that is the pattern. And certainly with emotional pain, you don't need to rely on this form of addiction. Physical pain may be a little bit, but even that is not necessary, because the mind is very strong, right? So we can manage both pain, even doing I think there are research showing how you can use hypnotherapy, which is related to NLP, like I mentioned, to do operation without anesthesia, right? So that is how strong the mind is. That it can withstand and manage anything, right?
Okay.
That answer your question, Dr. Natalie?
Yes.
Interesting question. Yeah.
Get it.
So back to you, Lalita.
Okay. So, doctor, what are the benefits of NLP rather than have lots of therapies? So, what is the benefit of using NLP therapy?
Well, there are many benefits. Of course, when we talk about addiction, then you can overcome your addiction, right? So that is the main benefit in relation to this topic today, right? That you no longer need to rely on whatever addiction it is, right? So we need to define what is addiction, right? Addiction, well, like Oscar Wilde, very famous British writer, novelist, he said anything pleasurable is addictive. So basically, anything can be an addiction, right? That is pleasurable. If we abuse it, it can be abused, right? And of course, certain people have an addictive personality, right? And we can even identify this physically. We have lab tests to look at, because addiction is linked to a brain chemical for neurotransmitters. This chemical is called dopamine, right? So this is what is giving us pleasure, right? And then maybe Uma can share with us a sample report of the neurotransmitter test showing dopamine low, for example, right? So this can be measured, and certain people are at a higher risk of having any form of addiction. Maybe their dopamine level is like lower than normal, right? So in other words, they are using addiction to manage their dopamine, you know. So the addiction is like a medicine that they are self-medicating themselves without knowing it, right? Uh, so the other way that you can use NLP is remember that television screen where we started with, right? So you can also use a healthy screen whereby the person, instead of using Panadol or whatever the addiction is, that can be using other activity, healthy activity to increase the dopamine, like listening to music, you know, having a good relationship, so you can implant, right, all these alternative activity in the screen, become base, and then seeing themselves in it, climb into it, right? So all this can be done as alternative form of their self or behavior that is healthy, and also helping them to manage their dopamine level, right? So what was the question again? Forgot.
Okay, doctor. I just want to share, doctor. I just remember about when doctor explained about the NLP. Last time my mother used to scratch her leg frequently until get blood. So one of my uncle, I think some kind of this kind of treatment he used. He asked my mother to imagine at before sleep. Imagine that my mother's leg was very clean. It's like shining, something like that. Just want to imagine like that every night, so that in some few months she stopped to scratch the habit to scratch the leg and stop the bleeding and everything. So I remember whenever doctor said about this technique and everything, it's similar to that. Not only like serious condition, it's for simple thing also we can apply this, I guess.
Yes, very true, very true. So your
Mm.
uncle, natural born NLP practitioner.
Yes. So doctor, if I'm as a therapist, so what kind of training is required to use NLP to help people to overcome drug addiction?
Yes, of course. We at IPC we will have a NLP, the training NLP basic and advanced, right? Professional certification courses to help one become a certified NLP practitioner, right? Whereby you learn all these different techniques, right? That are unique to NLP, and help not only people with addiction, but with all sort of psychological disorders like phobia, right? Or just wanting to increase their confidence in all sort of situations, public speaking, or in a social situation, patient with social anxiety, right? So it has a very wide applications and benefits for sure, yeah. Which is why it is very popular today. We had a webinar a couple of months ago about coaching, and if you remember Dr. Natalie, psychotherapy, coaching, and counseling. So NLP can be used in all three, right? It can be used as a coaching tool, as a psychotherapy tool, and a counseling tool as well, right? So that is um, the flexibility of NLP, right? A lot of coaches use it as well as psychology, psychotherapies, and counseling. So as you said, Anthony Robbins used it. So yeah.
Okay. Any question, Dr. Natalie?
Just thinking that means this NLP I think should be very good for the cancer patients.
Yes. Yes. So for cancer patients, how do you think it can be benefiting them with NLP?
Keep on thinking that when the time they're healthy, when the time they're happy with their life, when the time they're enjoying before they get sick, so they would eat. Then after that, maybe currently they feel like, oh, maybe only the authentic cell is only pain or not healthy only in a short while, maybe in a kind of period only. So after they overcome everything, then should be back to normal life. Then they can enjoying back, they can happy life like previously.
Yes, because we know that in research definitely when you feel better, it will help with your diseases, including cancer, right? But then unfortunately, a lot of patients, that are suffering from cancer and other diseases, of course, their mental health wise, that they feel depressed, they feel down, and that is going to worsen their diseases, right? So in this way, then if we can give the healthy resource state, right? So we call that a state, right? A mental state, emotional state. In NLP term, this is a state, right? So if we can help the patient to connect, like how I showed just now with pulling your ear, right? So to anchor back to the healthy state, to the resourceful state, then definitely that will help the cancer patient, right? To fight their diseases, for sure. Yeah, that is true, Dr. Natalie.
Hopefully all this can help better for the all patients, like not only cancer patients.
Yes, yes. There are a lot of psychotherapy technique that help, because we do know that cancer and many diseases are very much interrelated to mental state, right? When we are not happy, or we feel guilty, or we feel bad, then it is linked to the even the causes of the disease, right? So that has been established in many studies. So if we can reverse that by changing the mindset, the mental state of patients, that is true. Welcome back, Uma. We were asking about the dopamine neurotransmitter sample report. If you have that you share with us for participants to see. Oh, okay, here you can see the dopamine level 148, but if you go to the level here for the healthy level, optimum level is 250. So this is actually low for this patient, right? So this is an example on how maybe because the patient is feeling this low dopamine, then they are using all sort of addictive behavior to increase the dopamine level. But then we can also help the patient to use other healthier alternative to do that. Of course, there are also the nutritional medicine to increase dopamine. L-DOPA that we practice in the nutritional therapy courses and training and psychonutritional therapy as well. Thanks for that, Uma. Yes. So,
Doctor, can we know what are the success rates of NLP treatment for drug addiction?
well, unfortunately, NLP is not. There are not many what we call outcome studies for NLP, because NLP is not widely practiced by academicians at university. Although Richard Bandler and there were psychologists from university to start with, but it is one of those techniques that is very popular, but academicians do not study much of it, so that I'm afraid we do not know, Lalita. But certainly from our clinical experience, we see a lot of successes, that it is powerful to be used. But in terms of research, where you need large group of patients, compare one group with NLP and another group with another technique or no technique, that's part of research hasn't been done much. Maybe you guys can look it up, but not as far as I know that has been much published research on this type of outcome study of NLP, right? Yeah, but for sure we have a lot of testimonial on information on their successes in helping patients with all sort of addiction.
What are the costs for the NLP, doctor?
Oh, the cost as in the financial cost, is it?
Yes.
Right. Well, so this is another advantage of NLP. It is relatively very efficient, fast type of therapy. So you might need, depending on the situation, right? You might need 1 or 2 sessions, even one session might be enough to help you overcome like a Panadol, simple addiction. Maybe one session is enough. So it's quite cheap compared to the other form of therapy.
Okay.
Yeah. Yes.
Okay, do IPC have this service, doctor?
Yes. I myself is an NLP trained, and we have courses to train others in using it. Yeah. One of my trainer was well, I have several trainers in NLP, including one of the creator of NLP. I remember his name now, but but it is certainly the popular technique that can be incorporated, into other forms of psychotherapy, and it is useful in quite a number of psychological disorders, right? So, which is why we want to have this webinar today to let more people know that psychotherapy doesn't need to, to take a long time, to have many sessions, and sometimes even with one session, it can be like a powerful technique like NLP, will be sufficient to reverse, and cure many psychological conditions, right? Yeah.
Thank you, Doctor. Dr. Natalie, any question?
Yes, Doctor, I know, Doctor, using what kind of philosophy to train or to how to say use to for the patients? I mean, based on what kind of background? Because it's not so practiced widely the NLP in the therapy. Almost the people all using like CPD lah, all this really widely. But this one NLP is not based can hear. Then just now saying that also not much research, evidence based lesser than
Yeah. So NLP is used more by coaches, right? I think in Malaysia still the coaching is not as popular, but in Western countries, in America, there are a lot of coaches, mental the health coaches, life coach. I know many of them use NLP. So the in terms of qualification, coaches come from all sorts of background, right? They don't need to have a psychology degree or anything like that, and anyone can learn NLP, right? As long as you have the desire to help people, the passion, right? To learn, and it's quite it doesn't take long to learn it, which is another advantage, right? So in IPC we have part-time courses, right? Like most of our courses is like 2-3 months. You can have be accredited and training in NLP, and then if you want to have a practicing license, you can take the advanced course and one other course, then you can be a licensed practitioner of NLP and psychotherapy in general. So yes, it's a very versatile technique, and we would encourage more people to use it, and of course to do some research into it, which we do like, right? But yeah, but of course when you do that, you need financial backing to do some research. Yeah, but we do see the results for sure, right? In NLP. Yes. So
then
Anything
how about
else?
the philosophy? Philosophy as like this NLP.
the philosophy of NLP. Well, the NLP has a lot of what we call presupposition, assumptions, right? Which in common in many psychotherapy techniques, like the map is not the territory. It's a very famous NLP presupposition, meaning that reality, that the map in our mind is not a reality. For example, we have a map, that we need Panadol. But this map can be changed to another map that we can manage without Panadol, right? So this is the power of changing your map. Your map is not the reality, The reality is not that you need Panadol. It's just your map. So we need to help patients to make the distinction, right? So this is one of the basic philosophy of NLP. There are many type of presupposition of NLP, which will be taught in the course, right? Yes.
Mhm. Okay, thanks. At
No
least
worries.
got some idea.
Yes.
Okay, Doctor. I guess until here, our webinar for today. Thanks a lot, Doctor, for sharing lots of knowledge on NLP. Thanks a lot, Doctor, and giving me this opportunity to host. Thanks a lot. Thank you, Dr. Natalie.
Welcome.
Thank you all. Thank you, Lalita, for being such creative and dedicated co-host.
Thank you, Doctor.
Thank you. All right. See you again next time.
Okay, see you, Doctor.